All right, team, listen up.
Well, based on those symptoms, I would say it could be either a severe autoimmune disorder or a rare genetic condition.
I think it might be a case of chronic inflammation affecting multiple organ systems.
Actually, I believe it's more likely to be a systemic infectious disease causing these symptoms.
I'm leaning towards a toxic exposure leading to these manifestations.
Enough. The correct diagnosis is holoendemic, and the treatment we need to proceed with is pneumonectomy.
Pneumonectomy? Are you serious, Hawks?
I'm not sure if that's the right course of action, Hawks. There must be another way to treat this.
I agree with Leslie. Pneumonectomy is too drastic of a measure to take at this point.
I'm not comfortable performing the surgery if we're not absolutely certain, Hawks.
Damn it, just do as I say. This is the only way to save the patient. I'll take full responsibility. Prepare for the pneumonectomy, now!
Hawks pulls the full responsibility card. Let's see if he keeps that promise. Anyone have dice on them?
Gary, can you for one day role-play as a functioning doctor or anything at all instead of a rejected act for the Ringling Brothers?
I rolled a 1 this morning.
Story of my life. Anyway, go treat the patient. Tracy, I need to perform a pneumonectomy on my patient. I am convinced they have holoendemic, and this is the only way to save them.
Hawks, you can't just jump to such an extreme procedure without solid evidence. Have you considered all the other possibilities?
I have been in this field for years, Tracy. I know what I am doing. Don't question my expertise.
I'm not questioning your expertise, Hawks. I'm simply reminding you of your track record. You've been wrong before, and we can't afford to make mistakes here.
This is different, Tracy. I can't just sit back and watch my patient deteriorate. Trust me on this.
I understand your concern, but we need to approach this methodically. Let's not rush into anything that could harm the patient.
Fine, Tracy. I'll run more tests and gather more evidence before proceeding. But mark my words, pneumonectomy might be the only way to save them.
Leslie, this is not looking good. The patient is in critical condition after the pneumonectomy.
Oh no, I was afraid of this. We need to act quickly to stabilize the patient.
I know, but we also need to inform the Hawks that the pneumonectomy was not the right treatment for holoendemic.
Frank, let's focus on the patient first. We can discuss this with Hawks later. Right now, we need to do everything we can to save their life.
You're right, Leslie. Let's prioritize the patient's care.
What the hell were you thinking? You almost killed that patient by choosing the wrong pneumonectomary and misdiagnosing the condition?
I was certain it was a case of pleural effusion. It seemed to fit all the symptoms.
But the x-rays clearly showed signs of a lung abscess. It was the best course of action given the information we had.
I still believe it was a rare case of bronchogenic carcinoma. We couldn't have known for sure.
I don't know, but we did our best based on the data we had.
Your best almost killed someone. You call yourselves diagnostic experts. You're a disgrace to this hospital. I can't believe I trusted you all with such an important case. I'm done with this incompetence. You better get your act together or I'll find a new team that actually knows what they're doing.
And off he goes to find some bored kids spraying graffiti on an art supply store again.
So, Johnson, how's everything going outside of work? Any exciting plans for the weekend?
Oh, just the usual. Spending time with family and trying to relax.
You don't have family.
That's not true. I have a cousin. Given his poor health choices, it probably won't be long until he ends up here. Anyway, any interesting cases catching your attention lately?
Actually, yes. I've been working on this puzzling case that just doesn't add up. It's been consuming my thoughts lately.
I know what you mean. Sometimes those cases can really get under your skin. Have you made any progress on it?
Wait a minute. I think I've got it. Johnson, I have to go. I'll catch up with you later.
Wait, Hawks. What do you mean? What did you figure out?
I'll explain later, Johnson. I have to go check on my patient. Sorry I'm late, but we have a critical situation here.
Hawks, you can't just barge in here without proper gear. You're putting everyone at risk.
This is unacceptable. We have protocols for a reason.
Hawks, What's gotten into you? You know better than this.
Hawks, are you out of your mind? This is a sterile environment.
Listen, Hollow-endemic was wrong. It's not what we thought. It's Filippi syndrome.
Filippi syndrome. What's the prognosis on this one?
Is it treatable? What do we need to do?
Hawks, tell us now. Patients' lives are on the line.
The prognosis for Filippi syndrome is not good. It's terminal within 6 months. Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. I'm glad we got at the bottom of it.
Well, it wouldn't have been such a mess if my team didn't have to double check the work of your doctors.
Hold on a minute, Hawks. You were the one who initially declared the wrong diagnosis.
Maybe, but if your team had been more on the ball, we wouldn't be dealing with this in the first place.
That's not fair assessment, Hawks. You can't just shift the blame like that.
Look, I have other matters to attend to. Excuse me, Tracy.